Now, what are some of the side effects? Irregular menses are very common, actually, and it's going to depend upon how you do the protocol. If you do the protocol and you do it as per the original protocol and you start your HCG immediately after menstrual flow stops, and then you finish that cycle of HCG before the next period in a menstruating female, you will minimize irregular menses and menstrual irregularities. However, because of the hormonal mechanism by which this works, irregular menses can still be a problem if you do it that way, but less so. But especially if you do longer courses, such as certain practitioners out there are doing 30-day courses, 40-day courses in menstruating females, in which you would go straight through the cycle where the menstrual flow is occurring, you will generate more irregular menses and they will persist for a longer period of time. Also, because of the hormonal mechanism of this, if you have a patient on oral contraceptives, they do need a backup form of birth control. There have been reported cases of unplanned pregnancies in women that were relying on oral contraceptives. So be sure that you're having your patients use a barrier method if they're relying on oral contraception and you're putting them on the HCG diet. Now, this typically does not cause new headache syndromes. But if a patient has had a history of migraines, they can have exacerbations during the HCG diet, and this is something to please make them aware of so that you can start prophylactic regimens, what have you. Rare allergic reactions or edema, again, this is not very common. Hair loss is not uncommon, but it is typically temporary. It occurs in a very similar pattern to male pattern hair loss. This occurs sometimes with testosterone administration or replacement with patients, and occurs in that same kind of pattern. You can pre-treat patients with minoxidil. There are proprietary formulas. One of the vendors has one that has minoxidil and 2 or 3 other different agents, a retinoic acid agent, a glucocorticoid agent, and a natural form of a 5-alpha reductase type of substance in it, and that will really help a lot with hair loss. And I'd be happy at some point during a break to tell you about what that is, but that one is very good. Minoxidil by itself can be good. Topical saw palmetto you can have compounded can be good. But again, that's typically temporary. This reaction you should never see because you really shouldn't be having fertility patients in your weight loss practice, but there is a potential drug interaction where HCG interferes with this fertility drug.